Welcome from the Senior Law Day Collaborative. I'm Bruce Siegel, and I've been working with the collaborative for the last several years. And we are composed of more than 150 professionals who are all very eager to bring authoritative information, resources on legal, financial, and health issues to the older adults in Westchester County and beyond. Today's presentation is from two of our real star presenters, Deborah Truhowsky, who's a principal of the law firm of D.F. Truhowsky, Elena Falcone, Director of Public Innovation and Engagement for the Westchester Library System. Elena is also one of our co-chairs, along with Sarah Steckler and Melinda Bellis. So before I turn it over to them, just a few points about the format that we're working in within Zoom. This is a recorded event, but you are totally silent. No one can see you, no one can hear you, but we will be, for your benefit, posting this along with the presentation to the Senior Law Day website. That's www.seniorlawday.info. So please visit us there as well. You can ask questions via the Q&A, and we will attempt to answer those as we go along, or also at the end. And that's a little window at the bottom of your screen. If you're having problems seeing or hearing anything of a logistical nature, that you can write into the chat button, but please don't ask questions via chat. And with that, I think that's done. I want to give maximum time to Elena and Deborah. Thank you.
Bruce, thank you. Thank you very much for getting us going. Hello, everyone. I am delighted to be here today to participate and present with Deborah Truhowsky on the subject of making a choice using public data and good questions to compare nursing homes, rehabs, and hospitals. We're going to be sharing a lot of information today. Isn't that typical of the Senior Law Day program? But don't panic, because everything, the video recording, the presentation deck that we're going to share, everything is going to be posted to the website pretty promptly after the program. And better still, you can always ask us a question about anything that you've heard. We're going to be doing our best to respond to things in the Q&A, but again, we've got a lot to cover. So if we don't get to anything, so long as you don't enter the Q&A anonymously, make sure we have an email address for something where we could respond to, then we will do our best to get back to you. If you choose, though, you can also ask an anonymous question. And again, we'll take note of that. I'm going to send something in the chat. So you guys are going to use the Q&A, but right now I'm sending a link in the chat. If you have the ability, and for me, this is always a must do, you can look at the presentation deck on another device or print out the presentation if you like. That's a PDF that I've just shared with you that has 2 slides per page. And it really helps sometimes to be able to see what we're talking about. With that, one other thing I want to say before we go forward with the presentation is that in February of this year, Deborah did a fabulous presentation on the rights of nursing home residents and their families amidst the COVID-19 pandemic. And she and I had a great conversation afterwards about how there's a lack of objective available data on nursing homes. It's infuriating. And I was asking her questions about, well, how do you make the best of this? What do you think are the shortcomings? And we got into this great conversation about the quality of the data and the need for self-advocacy. And that is why we have this presentation today. So I'm just so grateful that Deborah was game to just explore this whole topic. This is her area of expertise. So frankly, I'm just glad she shared what she knows. So Deborah, I am going to, before I start, if you start talking, I think you'll be the focus. Do you want to say hi?
Good morning, everyone. Good to be with you today.
All right,
Thanks,
so I'm going to go
Thanks,
ahead.
Bruce.
Sure, I'm going to share my screen, which is going to be right here. Oops. I'm going to share my screen and then move myself out of the way. Whoops. All right, so here we have our presentation, and I'm going to put that link again in chat for the number of people who just showed up again. Sometimes the link isn't available, so that's a link to the full presentation. All right, and Bruce and Deborah, just confirm for me that you don't see the box that has your faces in it on the screen. You just see the presentation.
No, I do see the boxes with your video and mine as well.
I'm trying to tuck us off to the side. Sorry.
We are
I
to
did.
this. We are to the side, but I see us to the side.
Now you're totally out of there. Okay, so we're good. So again, this is making a choice about a presentation about public data, and this is a very consumer-focused presentation. So the first thing I wanted to share, I get to open this up, is to flag that this is one of those moments when we have to think of ourselves as consumers. And when you're a consumer, one of the typical bits of advice is buyer beware. In this presentation, we're going to be really emphasizing the importance of you taking action, knowledgeable action, when you're interacting with the healthcare marketplace. You need to ask questions, and that's come up in a lot of presentations that we've done. People sometimes are reluctant to ask questions of certain people in authority, particularly medical professionals and those in a hospital, nursing home, and other setting. You got to ask questions, and you should expect and get your answers. You're also going to need to see for yourself. So we're going to talk about data and places where you can get data to look at. And that's important because there are some objective data sources, but you also have to go look for yourself. So it's not ideal if you're not able to walk in at an unannounced time and see what's actually going on. So, and you'll see from this presentation that this kind of scrutiny and work and vigilance is absolutely appropriate when thinking about nursing homes. And it's important to do some planning in advance, particularly planning for advocacy, for self-advocacy. When you have someone working on your behalf, make sure that they know what to do, make sure you know what to do when you have to say something's not right. So that's one of the first things I want to remind you, that in this case, we are definitely consumers. What we're going to be talking about today are specifically these areas, the questions to address when you're selecting a nursing home or rehab facility, the objective sources of information to answer those questions, how the same questions can apply to assisted living facilities. Caveat, not so well, but some of it does. What to do when things go wrong, sources of information on hospitals. We may not get to that, but it's well covered in the presentation deck. So that may be our flex spot. And tips for self-advocacy. I definitely want to end on that strong set of sort of guidance for what you can do, which is especially strong because we have Deborah here, and she is not only an attorney, but she is a powerful advocate for people who are trying to resolve issues that have emerged. With that, Deborah, I'm going to ask you to go ahead and get started.
Okay. Thank you, Elena. Again, good morning, everyone. I'm going to start by discussing some typical scenarios that might lead to a nursing home stay. And what we really want to emphasize in this program is that you do have a choice in selecting either a short-term rehab or a nursing home for a long-term care stay. And what we also want to emphasize by this program is that by being familiar with the process, you can start preparing as early on as possible if one of these scenarios arises, so that you will not be rushed in terms of making this important choice of what nursing home facility a person may need to go to. So for the first scenario, what I often see in my practice is a situation where someone was living at home and they fell. And they thankfully didn't sustain any type of serious injury, but they still went to the hospital to be evaluated. And let's say they stayed in the hospital for several days. And as a result, they became what we may call deconditioned, which means that their ability to walk might be somewhat compromised. They might be a little shaky. And that may lead to some type of a nursing home stay for short-term rehab. Another scenario is that someone may be in a short-term rehab for just that short-term rehab from that scenario I just gave as an example, and maybe they fall again. And that fall may result in some type of serious injury, perhaps a fractured hip, God forbid. And now, because of that fractured hip, their condition has changed, their care level has increased, and they may not be as independent and able to go home to the same environment. And they may now need some type of longer period in short-term rehab or even long-term care. And so if one of those two situations arise, and if someone is in a situation that they might need a nursing home, what we want to discuss is on the next slide, we want to discuss what the strategy could be if someone is in that situation. And what I have noticed in working with families in my practice is that it's not uncommon that someone is in a hospital and someone has been there for several days, let's say, and then in the afternoon, a social worker may come in and say, all right, your loved one, family member is ready for discharge, and here is a list of facilities, and we're going to be making that discharge tomorrow, so let us know which nursing home to pick. And that, for most people, would be something very surprising and feeling overwhelmed perhaps by how to make the best selection. So what we're promoting and suggesting in this presentation today is to be aware that this may happen and to start preparing in advance so that you're not rushed in making a decision about picking a facility. So in order to do that, what we recommend is having a conversation with the doctor or with the social worker early on in the hospital admission so that you already know what type of care the individual will need and can start preparing for that in advance. And when speaking with the doctor or the social worker, there often can be 3 different scenarios if someone is now in the hospital. First, and the best would be that they could just go home to the same arrangement they had before, or they may need to go home with some type of home care, or lastly, they may need to go into a short-term rehab facility. Another good question to ask is, what is the trajectory of care for the next year? So again, you can start planning in advance and making the appropriate arrangements. And in those 2 scenarios, if it was the second scenario where someone is already in short-term rehab and they now may need to go into long-term care, what I just like reminding everyone is that just because someone is in short-term rehab in one nursing home doesn't mean they have to stay there for long-term care unless you're pleased with that care. If you're not pleased with that care for some reason, then you can start looking at other facilities and choose one of those for the long-term care situation. Now, what's important, in thinking about these choices and making these decisions, what this is, when discussing this, we said, this is a good reminder that why planning is important. And what I mean by planning is having a healthcare proxy, having a power of attorney. If those documents are in place, when faced with these types of decisions, it makes this process easier because there are already people in place that the individual has selected to help make these types of decisions. And it's a reminder that at the Senior Law Day Collaborative, we have wonderful resources for helping with these types of decisions and this type of planning. So please utilize those resources.
Deborah, can I just chime in to sort of flag how in the work that I've done with families, being able to ask the doctor or social worker the question, hey, is this gonna, how is this gonna play out? To have the courage to ask that question. It really requires courage, because I think a family is dealing with the immediate crisis and they're not necessarily thinking longer term. Is there any time when that's not an appropriate question?
Well, if someone is in a crisis type situation, if someone is, someone's condition is more serious, if they're in the intensive care unit and they're trying to stabilize someone and they don't know yet how someone's condition is ultimately going to be, then that's a great question, Elena, that it could be premature at that point. But so once someone is in what appears to be a stable condition, if their condition was never that serious upon going into the hospital, then that question can be asked. And we all know that it can be difficult to find the doctor because they're making rounds at all different hours of the day. And I think the key, and we'll emphasize that several more times, I'm sure, during the presentation, persistence is important. And again, and we'll also emphasize this, and moderating that persistence. It's important to be persistent, but one doesn't want to overdo it either. So I think it's always good to try to balance that, but don't give up. And that's another theme throughout this. It can be a frustrating process. We've all been through it, but just be persistent. And, it in the end, it pays off, and it's important to do, to just remain involved and continue to ask those questions.
Thank you, Deborah. And I think you framed the question really well. Even if I go in with a really bad splinter, what type of care is needed once I'm discharged from the hospital? Is there any kind of follow-up? I think we should get used to asking that question if we're actually interacting with the hospital. All right, we're going to go on to that next slide.
Thanks. Thank you. So if you find yourself in the situation where you need to choose a nursing home or a short-term rehab, what we recommend, there are 4 areas at least of investigation that you should pursue. And the first, and I really feel one of the most important indicators of a nursing home's quality and safety, is staffing. And we're going to show you some examples of how to find that data in the next several slides. There are things to look at: total nurse staffing hours, which we'll explain. It has to do with all the different providers, registered nurses, licensed practical nurses, aides, and also how many nurses how much nursing care per resident per day. And again, we'll get into that in a little bit more detail in one of the upcoming slides. But staffing and it really, I think, really is very logical about staffing. If a facility doesn't have enough staff, then how can they give good care? And that's why staffing is at the top of the list in terms of areas to investigate. Another area to look at is what type of compliance has the nursing home had? And what we mean by that is, are they having appropriate health inspections? What are the results of those health inspections? What are the results of the infection control inspections? And these are things that, again, we'll explain a little bit more detail as we move along in the presentation. Also, care planning. What care planning is when an individual goes into a nursing home, an assessment is done. And that assessment basically consists of determining what type of care that particular individual needs. And then a care plan is created that will address the specific needs of that particular individual. And so that care plan is very important because it's going to basically set the stage for what care the individual is getting and should be getting at the nursing home. And it's important in discussions with the nursing home, to find out what arrangements are made to allow someone's representative to participate in that process. And what I mean by representative is, when someone wants to be involved in another individual's care, there needs to be pre-planning with respect to that. For example, a healthcare proxy is created to designate who an individual wants to make healthcare decisions. If someone is incompetent and never created a healthcare proxy, then a guardian of the person could be appointed. Or in New York, we have a wonderful statute called the Family Healthcare Decisions Act. And this act actually sets a hierarchy of who would be able to make healthcare decisions if there is not a healthcare proxy or guardianship in place. And I like people being aware of that, because I never want a medical facility, a hospital, nursing home, a doctor to say, well, I can't speak to you because you're not the healthcare agent. If there is no healthcare proxy in New York State, the Family Healthcare Decisions Act will kick in and give certain people capacity, such as a spouse or children, to make those healthcare decisions. And so if someone is one of those classifications, they can speak to the nursing home about participating in the care planning process. Also, when speaking with a facility in terms of doing your investigation, it would be important to ask, who you could contact, again, if you have one of those areas of representation regarding concerns or complaints that you might have about care, or asking for certain information such as what medications someone is on when they're in the nursing home. So
on the next
now,
slide, we're going to be talking about how you actually, from now on, we're talking about how you actually get the information that you need. There are really only 3 websites that we're going to be directing you to in this presentation. But what we want to underscore is that it is important to independently gather some information. You might want to do this after you've gone for a site visit or before. I'm kind of in favor of doing it before, so you have a sense of some of the things to ask and some of the things to look for. But the data itself is not going to answer all your questions. You're also going to need to really be prepared to ask direct questions of the facilities that you're investigating, and then pull it all together and compare. Deborah, did you want to talk about a specific strategy for that?
Mm-hmm. Well, so as Elena was saying, we're going to show you some excellent websites. You want to do that homework and look at the data, because that data can really give you a much better picture of what is going on at a facility, and comparing is important. I know people, it's a daunting process and it can feel overwhelming, but comparing facilities is important. A lot of times, people, and I understand this, will want to pick the closest facility because they want to be able to get there and visit and make sure things are going okay. And that is absolutely important, but it's also very important to pick a facility that has higher ratings in terms of staffing and infection control and health inspections. And again, we'll give you some examples of that. Also, visiting the facility is very important. And right now, of course, we're unfortunately still in the throes of this pandemic, and visitation at nursing homes has been significantly impacted by the pandemic. But from my experience, I do believe if someone is making a choice of which nursing home to pick, that a facility will allow you to come in for a visit and to speak with the appropriate people at the nursing home. And that visit's very important, because the information we're going to show you is important as well, but it's really a complete picture, and they're different pieces, and you want to make sure that it's a good fit for your loved one or family member. And when you go to the facility, it's important not only to sit in the office with the social worker or someone in administration. You want to get out into the facility if at all possible. And what I would strongly recommend asking is to see the unit or floor where your loved one would be in, because there can be often a significant difference between the way the lobby and common areas look and the short-term rehab floor or the long-term care floor. And also, when you step off the elevator on a floor, if you're getting this overwhelming odor of urine, that's not good. That's not a good sign. Facilities should not smell like urine. And you also want to get a sense, do the residents look engaged? It's not a good situation if everyone is in a wheelchair around the nurse's station looking lethargic and as if they're sleeping. That's something that would be of concern.
Before we go to the next slide, I wanted to flag that there's 2 things you're not going to see in this presentation. We are not specifically looking at Westchester County locations. We actually chose Kings County in Brooklyn for the purposes of this discussion. And we're also, it's not Deborah's or my job to specifically recommend or not recommend a facility. But additionally, we're also not going to talk about how you pay for services. That was actually covered in a couple of other very excellent Senior Law Day presentations, which I'll refer to at the end of the presentation. So we can now jump to our first resource, right, Deborah?
Yes, thanks, Elena. So there are 2 websites that we're going to share with you today and discuss in some detail with you. The first is the nursingHome411.org. And this is a website that is from the Long-Term Care Community Coalition, also known as the LTCCC. And this website has a lot of really helpful and important data and information that we really encourage you to look at if you're in the process of trying to select a nursing home. And so on this website for the LTCCC, they have a learning center. And I just want to share with you some of the information in the learning center because I really feel it could be very beneficial. They have webinars, and the webinars are on a myriad of issues that affect long-term care. And you can either participate in those live as they're being presented, or they have a library of webinars that can be of help. They also have fact sheets, and these fact sheets are on care standards to support better care and the quality of life for long-term care residents. And they're meant to be fact sheets that you can print out and bring with you if you're going to have a conversation with the nursing home about something. They're really meant to be user-friendly and to be a resource. Also, speaking of resources, in the data center, they have resources for families and ombudsmen. There's even a free nursing home 411 Zoom room that families are encouraged to use for family council meetings or any other type of group meeting that people want to have that affects nursing home residents or long-term care residents. And when I mentioned family councils, that's actually something that you can look at in terms of the data. What if a facility has a family council? What a family council is a group of family members that will meet, and typically it's monthly, and family members will share concerns, information about the nursing home. And every nursing home has to allow and promote and share information about family councils. Another area in the Learning Center is resources about dementia care and antipsychotic drugging. And this resource is meant to promote good dementia care and to limit the use of antipsychotic drugs for residents. Also on the site, there is a data center, which we're going to show you in a little bit more detail in the next slide or two. And also news and reports about information concerning nursing homes and long-term care facilities.
I can say with all honesty, I lost a couple of hours just enjoying the wealth of information on the site. So I would really encourage anyone who's unfamiliar with it to go and explore.
Yes, absolutely. I know in preparing for the presentation, I spent more time myself on that website, and just reminded me of just the fantastic information that is there for people. So in terms of the data center, what is on this slide, and Elena really created a wonderful go-to of how to access different information on the 411 website. And the first area that is important to look at on the site in terms of the data, as I was mentioning before, how important staffing is at a nursing home. And one of the areas to look at is something called total nurse staffing hours per resident per day. And what that means is, what is the amount of actual care someone is getting from all the different care providers in a given day? And as I mentioned, that includes registered nurses, licensed practical nurses, CNAs, medical aides and techs, and even nurses aides in training. And another area is, and actually in terms of that, just going back a moment, there was a landmark federal study back in 2001. And what that study concluded was that residents require a minimum of 4.10 total nurse staff hours per resident per day to actually get sufficient care. So when looking at the data, that's an important benchmark to look at. Also, in this federal study, it also addressed how many registered nurse hours a resident needs per day, again, for sufficient care. And that was determined to be 0.75. And again, so we'll give you examples of that in the data we're going to show you in a moment. Also, CMS rates staffing, and the staffing is rated between 1 and 5 stars. And 5 stars is the highest and what you want to look for in terms of staffing. Also, health inspections. In perusing the data, you want to also look at health inspections, and they also are rated from 1 to 5, 5 being the best. So again, you want to try to pick a facility that has a higher rating in terms of health inspections. Also, when looking at data, you may see the term special focus. And what special focus means is that the facility has been identified as having serious quality issues, or they may be in some type of quality improvement program. And that is typically a red flag and something to be concerned about if a facility has been classified as a special focus. Now, in terms of the next slide, so on this slide, we've given you a snapshot of what the data can look like. And the data basically goes into an Excel spreadsheet, which can be a little scary, but when you work with it and you know, you get into it, it's not scary, or it's less scary. And as we've shown, there is the ability to filter data. And in this particular screen, what we have is, as Elena mentioned, we just filtered Kings County, just so you could see that that can be done. And then across the top, it might not be that easy to see, but there are different headings up at the top. You can see which facilities are for-profit or not-for-profit. You can also get a glimpse of if there are any in the special focus, which is the next category. As I mentioned about family councils, you can see if a facility does or doesn't have a family council, and that could be a good indication of how involved families are at that particular facility. If they have that, resident councils are where the residents meet periodically for the same reasons to discuss concerns that they might be having. The overall rating, I really don't look at that. I tend to just disregard the overall rating. And the reason is that rating is the combination of several factors. And one of them is quality measures. And quality measures is something that is self-reported by a nursing home. And anything self-reported, in my opinion, I would disregard. So the quality rating can be somewhat inflated from a self-reported data by the facility. So I tend to ignore that. The staffing rating, as I've mentioned a few times, is very important. And again, you want to focus on the higher ratings, 4 or 5, if at all possible. And then let's see, health inspections. With health inspections, again, you're looking at for the highest rating, so a 4 or 5, if at all possible. And the health inspections, we're going to also speak about that in the next website that we're going to show you. But just as I'm remembering to mention right now, because of the pandemic, health inspections were not occurring during the pandemic. And so when I've drilled down to some of the health inspection data, what I've noticed is that some of the health inspections, the most recent health inspections, are from 2019. And since we're now in 2021, you want to just be mindful when that last inspection was, because if it's a couple of years old, it may not be something that can be that comfortably relied on. Then we get to the total, sorry, my eyesight, the total nurse staffing hours. That's what I was mentioning before. So remember that from this landmark federal study, they determined that 4.1 hours was what was necessary for sufficient care. So unfortunately, we're not seeing a lot of facilities that have that. There is one facility that does have that. And what's interesting is often you'll clearly see the correlation between the staff rating, the higher staff rating with the higher total nursing total RN staff hours per resident per day. And in the next column, it has the total RN or registered nurse hours per resident per day. And if you remember, that federal study determined that 0.75 hours was what was necessary. And again, unfortunately, we're not seeing a lot of that as well in looking at that data. And that can be discouraging, but the message is pick the one that has the highest amongst other factors if you can. So I think that was, unless Elena, anything else that you...
Let me just add one other thing. As you look at the spreadsheet, be not afraid. There are at the bottom of the spreadsheet there. So if you're in Excel or Google Sheets, you'll also see there are other tabs. The notes section explains a lot of the terms that you're seeing here. And up here, when you expand these and when you're on the website or in whatever you've downloaded, there are video links that help you to navigate and filter and interpret the data. And finally, you can always contact a librarian. We can always help you navigate a website, help you to understand how to manipulate and work with the data. So be not afraid. And let me go on to the next slide. Oops, went backwards. Oops. I wanted to make sure you guys could see this well. Here we go. All right, the next slide is a focus.
Thanks, Elena. So what we thought was interesting about this was just an example of how you can really filter the data to just to get the closest snapshot or the closest list of facilities that and so in this particular one, what was filtered was again Kings County. And I just thought it'd be interesting to see a comparison of 1 and 5 star in terms of staffing facilities. So this was filtered down to which facilities are 1 star and which facilities have 5 star in terms of staffing in Kings County. And this is the list that it brought up for us. And unfortunately, there's only one with 5 stars. And there are several with the 1 stars. And again, just in looking at the total nursing staff and the RN staff, unfortunately, and it sort of goes hand in hand. And if it's a 1 star, it's lower than the that federal study recognizes as what's important for resident care.
And that's not a happy story to tell.
No,
Just gotta say.
No, it isn't. But again, facility, some people will say to me, well, every nursing home's the same and just, make a choice, but it isn't. And this information does show that there are differences in facilities and there are a lot of factors that do go into making that decision, and staffing is important. And as I mentioned, some of the other factors that we were mentioning today, and going to look at the facility as well. And, this reminds me of something that's really happened several times in talking to families, and that sometimes people will feel like they want to pick the prettiest facility and the one that, has all the quote unquote bells and whistles, but that doesn't always translate to the best care. And I've had families have the experience of first picking the facility that looks the nicest, not having a great experience, doing some research, picking another facility that may be older, may not be as pretty, but is clean and the staffing rating is higher, and their loved one has a much better experience. So that's just an example of, it's not just how does it look, to dig deeper than that.
The librarian gets to say, "Don't judge a book by its cover." Sorry. Okay, so let's go to Medicare.gov.
That's perfect. As we mentioned, there were 2 websites we wanted to show you. The second one, Medicare.gov, is also rich with very helpful and important information in making a decision with regard to a nursing home. And the data that is on the nursing home 411, it's basically the same data. So I don't want you to feel like if you go to one site, you'll see certain data, and if you go to a different site, you'll see different data. The LTCCC and their website, they have tried to combine all this information into the most useful, user-friendly format for people. But you are looking at the same data, so you really can choose which site you find is easier to navigate, or look at certain things on each site, because they do both have a wealth of information. And
So let me get you back to that slide. Here we go.
thank you. And so what Elena has been so helpful in doing is just really giving the steps to get to the areas that you need to go on these particular websites, so that you can find the information that we're suggesting that you look at. And again, that compare facilities. And again, reiterating that what you want to also look at on the CMS Medicare.gov site is staffing, health inspections. And one piece of information that's available on the CMS website is the COVID vaccination rates, which amidst this pandemic that we're all going through, that's really important data to look at as well. And it has rates with respect to residents and with respect to staff. And it was interesting to see that there really was a difference between facilities in terms of this information. As I mentioned before, the quality rating that is on the CMS site, that is something that is through self-reported data from the nursing homes. So I really tend to not focus on that when I'm looking at different facilities. And this is a great example of how you can filter and compare information on the CMS site. And so in this particular search, it was for a certain zip code and looking for staffing at 3 or higher. And then again, as a reminder, staffing is rated from 1 to 5 stars, 5 stars being the best. And so you can look at these facilities and then select a particular facility to find out more detailed information regarding that facility.
You can only compare up to 3. Is just something to know, and you can search by zip code. And I thought the map was a handy thing. But then you can go on to selecting the actual compare feature or a specific facility. And unlike the Nursing Home 411 site, it's a little bit easier to drill down to specific information on this site. Deborah?
Mm-hmm. And so, as I was mentioning, the COVID vaccination rates are important to look at. And in just looking at the data for these particular facilities that were being compared, you can definitely see a difference between the different facilities and the rates of residents or staff that have been vaccinated.
Before we continue, actually, just want to pause for some good questions. We are not in chat. Someone had asked, "Are we using Medicare.gov and the CMS site interchangeably in this?" No, the Medicare.gov site is something quite distinct. But Deborah?
Yes, I'm guilty of using those two terms. They basically do refer to the same thing. CMS and Medicare are the same. And so I apologize. I know that that's confusing, but they are one and the same.
And it's also asking a separate question. Are the sources of the ratings on the Nursing Home 411 site described? Yes, that's what's in all of that backup on the other sheets within the spreadsheet. And also it goes into some detail on how they compile that data on the site.
Yeah, right, and it is based on the data that Medicare does compile. So it's not their independent data. It's pulling it from the data that Medicare has.
And there's another line to this question, Deborah, that's right up your alley. Okay. Though inspections are supposed to be random, from experience, I have observed that a nursing home can somehow have advance notice and clean up and call in all staff to appear better than it actually is. How can one trust these ratings when these things happen?
Really good question and really good analysis. And it's true. I do think that nursing homes know when they're coming. I think they go in a similar pattern, every year, from my experience. And that's why there's no one piece of information to focus on. It's one piece of several pieces of information to really look at. And so you're absolutely right in terms of that. But again, what we're trying to arm people with is as much information as they can, and to, again, compile it all and then do a comparison based on really the totality of the information that you find for each facility, including going there to visit and getting a sense of how things look.
Thank you, Deborah. I'm going to get us to move quickly to a bit of the sort of the self-advocacy content. So I just want to say again, this website, when you go on Medicare.gov, when you go in there, you can expand each of these little arrows and you really see a lot more detail and can click through the actual text of a hospital inspection, of a complaint. It's actually quite lovely to navigate. And I had speaking of CMS, on the Medicare.gov site, there is a CMS report that I thought was actually quite useful for us lay people in all of this. And it had this is called Your Guide to Choosing Nursing Home or Other Long-Term Services and Supports. Mm-hmm. And I was thinking, oh, what's this going to be? But on pages 31 to 39 had a thought-provoking nursing home checklist. So I think everything that Deborah has said here is key, but there were there's other ways to inform your eyes and your thinking when you walk in to make that assessment. And I think this document, which I've linked here, is well worth taking a gander at. Deborah, did you want to say anything else about that? Otherwise, we'll move on to what to do when things go wrong.
Well, and as listed on this slide, there are really helpful booklets on the Medicare site as well. So, look at those things because they really are a wealth of helpful information, as well as the checklist that Elena was referring to.
Agreed. All right. So where can you turn when something goes wrong? Deborah.
Yes. So once a facility is chosen, someone's admitted, as Elena said, what happens if there's something that goes wrong? And we, again, want you to know that you have options, and there are several important resources that people have. And one of them is the Ombudsman program. And the Ombudsman program is actually a federal program, and each state and then county administers that program. And for Westchester County, which is considered Region 4 in the Ombudsman program, the Tri-County Long-Term Care Ombudsman program hosts that program for Westchester, Putnam, and Rockland. And I did just want to read that paragraph because it is a very important resource, and this is from their own site. They're here to protect the health, safety, welfare, human and civil rights of people living in nursing homes and adult care facilities. And they truly are committed, because I've worked with them for many years, they are committed to advocating for senior citizens. And they are a vital link between the residents that are in the long-term care facility and the government resources that are available to investigate and resolve their problems. And they really are a helpful liaison between the family, the resident, and the facilities. And so, use them. And we purposely wanted to put the contact information for the Westchester County Ombudsman. It's Judy Farrell. Contact information is there. And typically what happens is the way the program functions is that there is, if the resources are there for the volunteers, a volunteer assigned to every facility. And that person typically visits the nursing home once a week and is there to, again, help advocate between families and the nursing home if someone is experiencing some type of complaint or problem. Also, each nursing home should have a social worker, and that social worker is there as a resource for families to speak to again, address problems or concerns that they might have. And in addition to the social worker at the nursing home, if someone is experiencing a problem or a complaint, other people that one can speak to would be the nurse, the director of nursing, the nursing supervisor. There might be an assistant administrator or the administrator. And ultimately, if it's a very serious problem, a health concern, and it seems to be a situation that's getting worse and someone's health situation is seemingly critical, calling 911. And my experience over the years in working with families is that go with your gut instinct. If you feel that something is very wrong and your family member or friend's condition is very serious and you're not getting the facility to listen or to take action, you can ultimately call 911. And it's best that it's the person who has the legal capacity to do that, as I've been discussing, the healthcare agent, the guardian of the person, the designee under that Family Healthcare Decisions Act. But ultimately, you know, if you feel that it's an emergency, go with your gut instinct. Also, attorneys are there to help with different types of needs. There are elder law attorneys who can help with things that typically involve planning or resources to pay for nursing home care. And then there are also attorneys such as myself, and we sort of call ourselves neglect and abuse attorneys or nursing home neglect attorneys, who actually handle cases when someone has been seriously injured or, God forbid, killed as a result of some type of actions of a nursing home. So there are a lot of different resources for families, depending upon what the nature of the problem would be. And again, there can be a problem as minor as someone's dinner was cold to as serious as someone is in a life-threatening condition, or something less serious, but also important, such as someone is incontinent and wears an adult diaper and they're always wet and they're not changed on a timely basis. You know, that's a very important complaint to have. And just as I mentioned previously, assessing the severity of the complaint and then pursuing it accordingly. You know, if it's one day out of the week someone's dinner is cold, that's not good, but it's, you know, it can happen. But if someone is repeatedly in a wet diaper for hours on end, then, you know, that's something that's not appropriate, can cause other problems, and needs to be addressed, and to not stop advocating until it's addressed.
Deborah, I'm going to have to move us ahead a little bit. So just heads up to those who are participating. We're probably going to run a few minutes over because there's some absolute meat that we have to get to. And you've been asking great questions. So before we advance, I just want to say that I think one good question is to sort of two together. How do you not spoil the relationship with the nursing home when you're using the services of an ombudsman, since someone might be there for a bit? And given that, does the ombudsman only pertain to long-term residents? What about a short-term rehab relationship?
Great question. And to my knowledge, the ombudsman would be there for the short-term rehab residents as well. And that's a great question about, is it going to impede or impair the relationship? I have never seen that. I think that the facilities understand the role of the ombudsman, and and that's why the ombudsman is there to basically advocate, or, you know, be that intermediary with the facility. So I've never seen that someone contacting the ombudsman has resulted in a problem with the facility in my experience.
Thank you. And so we're gonna jump. You've talked about some of you really called out the differences between safety and quality in some of your earlier stuff. Can we talk now about how to file a complaint, these two units?
Yes. So along the lines, if something goes wrong, what can you do? And in addition to what we spoke about on the previous slide, we want you to be aware that complaints can be filed to different government agencies. One is the New York State Department of Health, And there's a phone number on the PowerPoint slide for that. You can also go online and file a complaint that way if you're more comfortable. Also, the New York State Attorney General, they have a unit called the Medicaid Fraud Control Unit, and there is the number posted for that. You may think that that's limited to some type of financial fraud in terms of Medicaid dollars, but the premise of that unit is that government funds are being paid for people to get quality care. And if someone isn't getting quality care, then that could be a fraudulent action. And so this unit covers much more than just financial type fraud. And you can file a complaint with both of those agencies, or one, if one feels what the complaint is about falls within the jurisdiction of the other, they will forward it, but you can file a complaint with both.
And there was something you said to me was that you're filing a complaint because of the experience that you have, but you're also potentially protecting someone else from having the same experience. So think of the kindness of that action, not just the importance of the resolution.
That's a great point. And one last quick point I'll make is that sometimes people will say to me, well, I've filed a complaint with the Department of Health and maybe nothing was done. But don't let that deter you from filing again for exactly the reason that Elena said. And I also feel that the Department of Health needs to know if something is still going on in a facility that's unacceptable. So, make that complaint again, even if you may have been frustrated with a previous complaint and how that was handled.
And if you would, I'm just going to cover this next slide and get you to the one that follows. You said something also in the prior slide and earlier to me about when talking about your rights in a nursing home, one of the things that the word that didn't resonate is when you're staying there, it's your home. And you have rights that are consistent with that experience. And that's not how I think people feel often when they are in those environments. And so you had a great presentation in February about are you prepared, what your rights are during the COVID pandemic. But you really underscored for me that there are a number of laws, all of which y'all can Google, and you can quickly get the text and review them, but you have the basic right to be treated with dignity and respect. So that you had a lot of examples for that, but what I really want you to do is cover that when we're going over this wonderful eye chart.
Okay, thanks, Elena. Yes, so we definitely want people to leave this presentation knowing that people have rights. People don't lose their rights because they go into a nursing home, and there's actually a nursing home bill of rights that exists, and that facilities need to provide to residents and family members, give them a copy, make them aware of it, and most importantly, implement it. Facilities are required to create policies and procedures so that these rights are actually provided to residents on a daily and regular basis. And just some of the bullets, I know we're running over on time, but dignity, respect, quality of care and treatment, freedom of choice to make your own independent decisions, be free from restraints, both chemical and physical, choose your own activity schedule. And people who have a loved one in a nursing home may say, oh my gosh, that's not realistic of what I experience. And it may not be of what you experience, but it should be what you experience, and what is important to advocate for, and to don't lose sight of what should be happening, even if it isn't what you're experiencing.
So we made sure that this PowerPoint presentation was something you could refer to. So all of the stuff is there for you to read later on. How about assisted living, Deborah?
People may be listening to this and saying, well, yes, what is assisted living an option in addition to home care or short-term rehab? And it definitely is an option. Unfortunately, there is not nearly the amount of data that is available for assisted living that is available for nursing home facilities. But that doesn't mean that you have no information. The Nursing Home 411 site, we've listed questionnaires that are on that site that provide important information to consider when evaluating different assisted living facilities. Assisted living facilities now, depending upon their licensure and certifications, can provide really a diverse amount of care for individuals. So really find out what that is. And importantly, go to the facilities, ask questions. Those same recommendations apply for assisted living that would apply to nursing homes as we have been discussing today. Go to the floor in the particular assisted living where a person would be residing.
Right, and our next one is going to be, oops, how about hospitals? I'm not going to cover this. I knew we might have a bit much here, but I would encourage everyone to please take a look at the presentation, because hospitals are where some of this starts, right? Something happens there. And it turns out there's reasons to know about the safety record of your hospital. And there's a wonderful website called Hospital Safety Grade that collects data and presents it. And there are a couple of areas that it's worth understanding how your hospital scores. And to look at some of the guidance that they have there about what you can do, right? We don't often have a choice about a hospital, but if you walk in knowing, they don't have a good track record for this, then you have someone, you yourself can advocate for yourself. You can ask your medical provider, how are you going to keep me safe given that they have this kind of rating? These are questions you have to, I think, be comfortable asking those questions, and they help you to frame those questions in a respectful and appropriate manner. What I really want us to close with today are some practical tips for self-advocacy. And I think this was going to be a duet with Deborah and I. So I'm just going to read off the headings, and Deborah, I'm going to ask you to sort of chime in. So the first of, we have 6 tips, because that's really the key of all of this. You get your data, you do your comparison, you do your observations, and you ask questions. And if something goes wrong, you take action. So know your rights. We've covered rights quite a bit here. Have your facts in hand. Do that homework. Jot things down, and frame your questions. And be clear about the results that you want. What would constitute a satisfactory resolution, Deborah?
And don't give up. I know I've said that at least once, maybe today. In terms of in terms of advocacy, I truly feel that we all do need an advocate when we're in a nursing home and in a hospital. And it can be frustrating. You can feel like, oh my gosh, it's not really working. It is. You may not realize it, but I really feel it is. And so don't give up, be persistent, use those fact sheets I was mentioning on the Nursing Home 411. There are specific fact sheets to enable you to really know what the rights are and what points to make. So utilize those resources that are available to you.
And the other, and tips 4 to 6, which, but by the way, I was riffing off something that Liz Valentin of the New York Law School presented recently at a presentation. Be prepared to negotiate. Okay, Deborah said, don't give up, but tell people that you need to meet to discuss this, and gather the appropriate team to be at that meeting. People who have perspective and can help to right whatever the problem is. Be prepared to appeal. If you're not satisfied, you're going to go up the chain of command. We all know that. Let me talk to your manager line. Well, that also applies here. And if you're not getting the satisfaction you need, do go ahead and file a formal complaint. We've given you some of the ways that you can actually go at this. Deborah?
And in terms of negotiating and bringing allies, just a reminder that the ombudsman can be an ally in terms of those discussions with the facilities. And you may feel more comfortable even having the ombudsman there with you as well. And once you've reached a resolution, let's say you've negotiated a resolution, don't just assume that resolution is going to be implemented or followed. It's important to follow up to see that those changes have been implemented, and not only implemented, but sustained, and they're ongoing, and use whatever visitation is available to you. I know families have been very frustrated by the lack of ability to visit, that they have to either do window visits or they have to use virtual visits. My strong recommendation is, don't let that deter you. Whatever opportunity to visit that you're given, pursue that, because you can still get a sense of how someone's doing, how they look. This is someone that you know well. And even if they may not be able to communicate back to you if they have some type of cognitive problem, you could still get a sense of how they look. Are they well taken care of? So utilize those opportunities.
Someone actually just asked a question that pertains to what you said here. Can you work with the ombudsman for complaints with hospitals? Is that same person that we identified before?
Not with hospitals. No, to my knowledge, it would just be long-term care facilities and adult homes that they're able to assist with.
But within the hospital itself, it often has an ombudsman that's identified that you could go to. I know I personally have asked to speak to that person in a hospital.
Mhm.
Is that true for every hospital? Are you familiar with that?
I'm not sure, Elena.
All right, I can follow up more on that question as to what the right course for complaint would be. I believe it's on the hospital safety grade site. So I'm happy to follow up with the person who asked that question. Okay, I think we've gotten most of the critical questions there. And for the last thing I'd like to bring up is that there are a lot of related presentations that have been done in the last several months. This is just from 2021, I believe, of our webinars that are posted and that cover similar content. This webinar will be posted probably tomorrow, the video, but the PowerPoint presentation I just shot out in text again. That'll also be posted, but I just sent out a link that you can click on in the chat. And that will take you directly to the presentation, and which has a couple of the slides that we didn't get a chance to cover. Please go to the seniorlawday.info website to see some of the other related topics to this whole subject of nursing homes and making medical decisions. So really, if you remember just one thing, seniorlawday.info, you can ask some more questions, you can get a lot of information, and I'm going to end it. I'm going to stop the share with that.
Elena,
thank you so much.
Thanks very much. This was amazing. I learned a lot, but there were two questions I wasn't sure if we addressed. One on warehousing in a short-term in a rehab facility. Someone had about that, about whether people were kept there longer than needed. And then there was also someone had a question, I'm not sure we addressed, about are there nursing home brokers that can help you?
Yes, the nursing home brokers question. The warehousing one, I'm actually not seeing it. So for the nursing home brokers, Deborah, what do you think about the use of them? I'm not sure what you actually call them, but the people who take, those people who take families to skilled nursing facilities. I think they help negotiate and gather information.
Well, I think I'm not sure specifically which organizations are being referred to in the question, but I think whenever considering working with someone who can be classified as a broker, what's important to know is how are they making recommendations? What is the basis for them to be making recommendations to an individual? And how are they compensated? And so that you can know, what drives them. And because you want to make sure that there is as much objectivity as possible in whomever is guiding you in making this decision. So you really want to investigate them as well before relying on them to help you make such an important decision. And I would still use the other data that we're suggesting today, so that, again, you really have done your due diligence and homework to make sure that really this is the best facility.
Excellent. And the question about warehousing residents, quote, my mom is currently in a facility for short-term rehab. However, it appears they are moving at a snail pace to prolong the rehab process to run the clock. Any suggestions? I have been there for this experience, so I'm curious how you can answer that.
Well, I think the important question is this person's loved one getting the rehab they need? Why are they there? Are they progressing? Because I've also seen the reverse, where if someone isn't progressing, a family's being told, well, Medicare isn't going to pay for this anymore and you need to leave. And families feel the opposite, that they haven't gotten the care they needed and it's premature. So I think it would be important to schedule a meeting with the people at the facility, either through the social worker or, consulting the administrator or the director of nursing, to find out what's going on and why is your loved one still there, and are they getting the care they're supposed to be receiving?
Thank you.
Well,
Bruce?
Thanks again, Deborah and Elena and everyone for listening to this very, very informative presentation. I know we did get a bit over. I did want to just do two things before we let everyone go and get on with their day. One, I wanted to thank our sponsors So we have a lot of institutions and foundations that sponsor us, and without them, we wouldn't be able to have these webinars. So thank you very much. This is the full list. I'm showing my screen. And then the last thing I'm going to do is share a quick opportunity for you to provide feedback on this webinar and tell us how you heard about this. So that should be on everyone's screen if you want to take a moment to fill that out. Don't see any responses yet, but I'll leave it open for just another minute. There's one.
Thank you, everyone. Deborah, it was a delight learning more about this with you. And folks, don't forget to check the website, and you can always go to the library to get more information. And Deborah's and my contact information is at the back of the presentation. So you'll have all that handy.
It was a pleasure to be with everyone. Thanks for your excellent questions and appreciate your comments. Thank you.
Okay. All right. Well, I think we're good then, and everyone have a great day.